dynamic, and I think just such a pioneer for the work that she's done as an ally for over 30 years.
When I was a young medical student, I had amazing mentors that helped really inspire me to be better and a better physician and to take care of marginalized communities, including our own community. I'm so glad that Kay was there to mentor so many hundreds, if not thousands, of individuals in healthcare to provide safe spaces, to provide a better access to health and health equity for our community.
Kay references herself as the AIDS doc, and I think for 30 years, she served the community. She realized that there was this underserved community, the LGBTQ community. And as a family physician and seeing that there was this huge gap in services and an entire community that wasn't getting adequate and equitable care, she chose to go after and make herself available to our community.
I became known in the community as a safe doc to go to if you were gay or lesbian or bi. And my gay men patients started getting AIDS. So I had to become an AIDS doc because that's who, I think at least 40% of my population, my clinic population was gay or lesbian or bi. And so I had to become an AIDS doc. One day I was seeing a lady, probably in her 60s or so, a little bit older, and she said, "Dr. Bauman, didn't I see you on TV the other night talking about AIDS?" And I said, "Yes, that was me, I'm doing some of the news reports." And she said, and I'm expecting her to say, "Will you refer me to another doctor, please? I'm a little afraid now to be one of your patients," because that's what we were trained to expect. And instead she said, "I want to thank you. My grandson is gay, and I'm so glad there are doctors out there for him."
This spring at SAFE, we started seeing patients at Safe Health. And I know that we wouldn't have Safe Health, we wouldn't have this opportunity to provide health care for our community if it wasn't for physicians like Kay Bauman. Kay was a pioneer. She led our community, she led our country in ensuring that LGBTQ folks, that folks living with HIV, had health care with dignity. And back when she was working in this, back in the 80s, that was taken for granted. We didn't have health care with dignity. She mentored so many folks in medicine, so many medical students, fellow physicians, nurses, and other people in healthcare to make sure that we had safe environments for people with HIV and LGBTQ folks to receive health.
Something that Kay shared one day is she wanted to take folks from being tolerant to becoming advocates. And I think that's such a true statement about her. Really trying to help teach folks how to go from, if they're just tolerant of someone, to how to really champion and advocate for them. And to me, Kay is the epitome of that and has been for 30 years in this community.
One of my definitions about myself, I think, is celebrating diversity. And that's part of working with a gay, lesbian, bisexual, trans community. I just have lovely experiences in working with diverse populations.
It's taken a long time, but to have somebody who's stuck with us this whole time to help see us get to where we are now and us being able to move forward with actually opening up SAFE's own LGBTQ affirming care clinic, I think is such a testament. And we're so proud of Kay, we're proud of the community, and we're proud of the voice that she has always given.
I think my sense of humor has benefited me throughout this working in the AIDS epidemic in diverse populations. When I left Arizona to move to Hawaii, I got the Fairy Godmother Award. And you have to think about the language back then, and that was, again, so just from the community, and I just thought that was so special. Who else could do that? Straight people couldn't give that to me.